Okay, so we're going to do a quick rundown of a couple of specialty nebs. These are definitely not used as frequently, but you guys will surely come across most of them by the time you graduate. Um, the ones that we're going to talk about are the small particle aerosol generator, also known as the SPAG. Now, this is something you will never ever see. I was really on the fence about taking it out. I took out that ultrasonic nebulizer. This one I am leaving in because I saw in a grid for the board that they still use this in some of the questions. It's really easy to memorize for a flashcard. It'll keep you from getting one wrong. So we're going to do like a quick little blurb about it, but just know that what I tell you, throw it on a flashcard and file it in that random bank of information that you're going to use once, and then it'll probably end up being not something you use again. Vibrating mesh nebs, how they work, advantages, disadvantages, and then we talk about different nebulizers that are just for very, very specific medications. So the SPAG, this is your screenshot of everything you need to know about the SPAG. It's used to deliver ribavirin or Virazol. So this used to be used all of the time to treat RSV. RSV is a seasonal virus that's pretty gnarly for kids. Particularly kids that were premature get affected by this pretty intensely. The virus is kind of one where you just have to let it run its course. And what's hard about that is these kiddos usually need a decent amount of respiratory support while the virus is running its course. So it used to be the protocol that they would deliver this ribavirin, which is an antiviral that supposedly had helped decrease the intensity of the virus and the timeline of the virus. They have since, through different studies and things like that, gone away from this as a treatment. So kind of the acronym for remembering the RSV is ribavirin is the drug, SPAG for S is the way that you deliver it, and Virazol is the brand name. So having that on a flashcard, it's not going to hurt you to memorize it. You'll get it right on your boards if it comes up. And then you will probably never ever see it in clinical practice, and hopefully it will get edited off the exam because, being that we're evidence-based, medicine keeps updating, these things continue to kind of go away, and then the timeline for which the board takes them off is a different timeline. So it's pretty easy to memorize, and then just file it away in that little part of your brain. Vibrating mesh nebs. So these are very, very cool, I have to say. We use a version called the Aerogen at Gunderson, but I'm a big fan of these, especially in the NICU, because they are so quiet. They don't add flow to the circuit. They're very nice for not waking up kiddos. Very cool. So electricity is what's actually going to create this mechanical movement. And then when the mesh vibrates, it forces like the liquid neb through these openings. Depending on how big the mesh is, it's about 2 to 3 microns for the med delivery. The mesh creates like a physical barrier between the medication reservoir and the aerosol, so it prevents exhaled pathogens from getting into the reservoir, so it's pretty clean from an infection control standpoint. And you have significantly less residual volume, which means you get much more of a respirable dose than a normal SVN. So these are just a couple of versions of vibrating mesh nebs. This is the one that Gunderson uses. This is like the electronic part where you'd hit the button, turn it on, it goes in, and then this feeds it into the line. There's a lot of different versions though, so you guys could definitely come into contact with more than just one. So big advantages to the vibrating mesh nebs. Does not add flow to vent circuits. Really, really remember this. When you are trying to do a neb or and this is really particularly important in the NICU peds where the additional flow, because of how small your patient is, would actually change your ability to ventilate well. In adults, this is not so much an issue, but one of the huge advantages is that it does not add flow to the circuit. And the reason it doesn't add flow is that vibration of the mesh is actually how you're getting that neb to aerosolize. Whereas when you think about your small volume neb, you're hooking it up to 8 liters of flow, right? So this one, you don't have to hook it up to a flow meter. You're literally turning on a power source. It's vibrating and it's creating that aerosol. So you don't have to readjust your alarms on your vent. For neonatal ventilation in particular, you can really add a lot of tidal volume with a very minimal amount of flow, especially when you're talking about your babies that are about a pound. So these things are huge. And when they came out with these, this was a very big leap in treatment advantages for those little peanuts. Less residual volume than the ultrasonic neb. I keep missing this little thing. Realize that I will do better with that, but I am not going to make you guys learn about the ultrasonic neb. So anytime you see USN or ultrasonic neb, just know that I just didn't delete it. I didn't catch it on that PowerPoint, and I am eliminating it from your guys' data bank. But it's less residual volume is kind of the big takeaway. You're going to have more of that medication actually delivered to the patient, not left in the cup. Another huge advantage. Less energy, less heat required, so palmozyme is okay. So this is something that links to the ultrasonic neb. So this is not really one that you need to know, just realizing that it can be used for a lot of different medications. It's not limited by heat. That's kind of the big takeaway there. It's reliable and fast. It lasts maybe 2 to 3 minutes and the whole thing is delivered, so pretty cool that way. It's completely silent. There is no noise. And again, this is a huge advantage when you're talking about the NICU peds population, especially when you're talking about those poor little asthmatic kiddos that get nebs every 2 hours. You can sneak in there, turn this thing on. It feeds right through whatever device they're on. If they're on a high flow, it goes right through it. If they're on a vent, it goes right through it. CPAP, right through it, and it makes no noise. So that is really, really great. And it just really can nebulize most solutions and suspensions. It's not really limited by very much. So this is a great device. The other thing to kind of point out with specialty nebs is sometimes the drugs dictate the neb. So this is just like a brief little slide where I give 2 examples of where they developed a medication. You can look here. They developed a medication. You don't have to know these medications. This is not something you have to memorize. This is just a thing that I think is cool. They made a medication to treat something, and then they designed the neb to deliver it. Again, really, this is just a nerd thing, not something you're going to be tested on. It just sometimes the medication will come and they will come up with a way to deliver it very specifically for that med. So the reason that I kind of include this is because I'm a nerd. And then also realize that in your field, especially if you guys go out in the world and you work at bigger facilities and things like that, you're going to see some crazy stuff that you've never come into contact before with, because you're going to have patients with all kinds of different medical backgrounds. And I've had it happen in my career. And so it's your job to just, like I said, there's YouTube, there's the internet, you figure out what the drug is, you figure out how it's used, and then you try to make yourself an expert before you go see that patient. Another example of where drugs dictate the neb, and this one you guys are going to want to know a little bit about, is there's this called peri-E-flow. You don't have to memorize that name, but it's a version of a vibrating mesh neb. And what I would do is just kind of make a little mental note of this UFO looking nebulizer here, because with CF patients that come in, they will have these nebulizers, and they're used for either tobramycin or Caistin. And the thing that's great with CFers is when you look at the thing and you're like, I've never seen that before, and you do your little Google search, they also are a wealth of information and usually can tell you a ton about it as well. But this is one that I would say I see once every 6 months. So I just included this because it's kind of an interesting one, and it's definitely one you'll probably get a chance to see at some point. And that's for cystic fibrosis patients. Okay, the Respigard or scavenging neb. This is something you guys, I'm just going to tell you this because I know at Mayo last year, this was a source of confusion, and one of our students had kind of an exposure. If ever the respiratory therapist you are with is going to deliver pentamidine, you can stay with them while they set up the nebulizer. You do not go in the room with them. If they ask you to go in the room, you can tell them that I specifically said that you cannot, like you are forbidden by Western policy. The reason that I'm making such a big deal about that is pentamidine has a lot of side effects for people that are in, for lack of better words, their fertile years. If you are still in your baby making years, male or female, this is a drug that you shouldn't be exposed to. The other reason that I really don't want you guys going in for these at all is, depending on how it goes, there was some instances last semester where the therapist didn't use all of the proper protocols to prevent occupational exposure. So bottom line, if it's pentamidine, you guys can watch them set up this scavenging neb and you can watch them get ready. You do not go in the room when they deliver it. And we will go through this more in lab and we'll talk about why, but I just want to throw that out there. The reason that it's called a scavenging neb is it's designed with these different filters. So there's a one-way valve here, there's a filter here, there's all these extra pieces on here, and they're all designed to make sure that almost all of the med goes to the patient and none of it goes out into the environment because of the pentamidine side effects, which we will talk about in more detail. So pentamidine, which you guys should have talked about in pharmacology, is an antiprotozoal agent. It's used to treat a pneumonia caused specifically by pneumocystic jirovecii. You'll hear or you'll see it kind of abbreviated as PCP or PJP. It's a pneumocystis pneumonia, and it's primarily seen in immunocompromised patients. So this is used routinely as a maintenance med for patients that are at higher risk for this kind of pneumonia because of HIV or AIDS or other immunocompromising chronic diseases. So they'll come in, I think it's like every 6 months, and they get one of these treatments, and it just helps to lower their risk. It's recommended as an alternative to oral medications because if you think about the ability to have a very localized effect of a drug versus a systemic effect, if you can just inhale it versus digesting it, this is why they do that. Every 4 weeks. I was way off. Every 6 months. Look at me. You can tell that I've delivered pentamidine recently. So it's every 4 weeks as a prophylactic treatment. I should read my own slides. That's an important part of being an instructor, just FYI. The big thing with this one too is when you deliver pentamidine, you want to make sure that you give some sort of SABA before you deliver it. When you take this mist in, it's kind of sticky, it's very dense, it can cause bronchospasm to these patients. So one of the things that they recommend as part of the protocol is to make sure that you're giving some sort of SABA beforehand. So just know that that's part of it. And again, because this is something that is, I don't want to say low frequency because they come up, but because it's probably not something that any of you are going to be delivering, given your current ages, just kind of like keeping this in the back of your mind, the protocol for this. And then the other big thing is that you always have to have the patient in a negative pressure room. So this is something where if you come into the clinic to get this, there's negative pressure rooms that are assigned for it. If they're in the hospital, they'll move them to a negative pressure room. And then there has to be, I think, a 3-hour or 4-hour window after the medication has been delivered where that room doesn't get entered into. So that's kind of the spiel about pentamidine. The big takeaways that I want you guys to know is, obviously, I want you to know the medication name, brand name. I want you guys to know that it's an antiprotozoal agent. I want you guys to know what pneumonia it treats. I want you guys to know about the SABA because of the bronchospasm and giving it to them. And then just understanding that this is something for immunocompromised patients. And that is it for that PowerPoint.